I'm Dr. Srihar Shaju, consultant urologist, andrologist, robotic and transplant surgeon practicing in Bangalore. Today I'm going to talk about basic details you should know about prostate enlargement. First of all, what is this prostate gland? Prostate gland is a walnut-shaped organ present just below the urinary bladder. What are the functions of this prostate gland? In young age, prostate gland helps in production of the semen. It gives nourishing fluid for the sperm and it helps the urine to pass through it into the urethra. As age advances, the prostate gland size also increases. This may be due to hormonal changes in our body. As the size of the prostate increases, it compresses the urinary passage and creates obstruction to the urine flow. In turn, that creates urinary symptoms in men. What are the symptoms of this prostate enlargement? This creates mainly of urinary symptoms. Urinary symptoms may be increased frequency of urination, or you may get up too often at night to pass urine. You may feel that you are not empty the bladder even after urination. You may get the urine flow may be very thin, or it may fall just in front of your legs. These are the main symptoms of prostate enlargement. If you are aged above 40 to 50 years and if you are having these symptoms, then you have to consult urologist. Once you go to urologist will assess or confirm the enlargement of prostate. First, he will do clinical examination like digital rectal examination and genital examination, and then he may advise few tests for confirmation and to know the severity of symptoms. These investigations may be ultrasound scan. Ultrasound scan they do twice. One is before passing urine and after passing urine. Another one is uroflowmetry to know the weakness in urinary stream. Next is prostate specific antigen or PSA to screen for prostate cancer, and urine culture to know for infections. Once we confirm the diagnosis of prostate enlargement, then we advise treatment. Not all prostate enlargement require surgery at first visit. Initially, we advise lifestyle modifications like reducing water intake in the evening, avoiding stimulants like coffee, tea, cigarette or alcohol, and dietary habits. If lifestyle modification doesn't work, then we advise medicines. So medicines will relax the muscle of the prostate, or it may reduce the size of the prostate to some extent, in turn increases the flow of urine. Initially, we try to postpone the surgical intervention using these medications. These medications may run from few months to few years. After a few years, these medicines may not work. In that scenario, we advise for surgical intervention. So if we have complications of prostate enlargement in the first visit itself, then we may advise surgical intervention in the first visit itself. So what are the complications of this prostate enlargement? One is urine may stop completely one day. We call it as acute urinary retention. You may get frequent bleeding while passing urine. You may get frequent infections because of these urinary retentions. We may see stones inside the bladder while doing ultrasound scan, or it may produce the back pressure changes on the kidney, creating kidney failures, or the bladder may become completely weak, so that it no longer able to push the urine out, and the bladder capacity may increase to 500 to 1000 ml sometimes. These are the complications of prostate enlargement which requires immediate surgical intervention. So surgical intervention is required when you have all these complications and when you have exhausted all conservative treatment like lifestyle changes and medications. What are the surgical treatment available for this prostate enlargement? Because of advancement in technology, the morbidity of the procedure has come down in recent days. Urologists may give you multiple options regarding surgeries. Nowadays, the morbidity has come down due to advancement in surgical techniques in prostate surgery. So what are the surgical techniques available for this prostate enlargement? One is traditional open surgery, that we open the bladder and go inside and remove with hand. Another one is robotic surgery, where same open surgery is replicated using robot. These are the major surgeries. So next, less morbid procedures are laser surgeries or TURP. In TURP, which is commonly done worldwide, in TURP we use electrical energy to shave off the enlarged prostate which is blocking the urinary passage using an endoscope, and it is done through the urinary passage. We call it as urethra. Less morbid procedure compared to open surgeries. Little bit advanced to this TURP is laser surgeries, also called as whole leg or green light laser. These laser surgeries will have an advantage of removing the maximum amount of tissue like open surgery and minimal invasive like TURP. This has got advantages of all other surgeries where you have to stay in hospital less than 24 hours, but it removes maximum amount of tissue, which is less painful with least complications. Nowadays, some more advanced procedure or very minimally invasive procedure, otherwise also called as mist therapies, are available, but indications are very specific for this very minimally invasive procedures. These procedures are urolift, in which we put a implant to retract the obstructing lobes. Resium, also called as water therapy, we inject hot steam into the prostatic lobes, which eventually shrinks. Another one is ITND, that is, we put a nitinol wire to cut the enlarged, blocking the prostate in the bladder neck. And these procedures are not for all the patients. They are specified for specific indications which you can discuss with your urologist. So overall, prostate enlargement is an aging process like our graying of hair, or you need not have to worry about prostate enlargement because of advanced treatments available nowadays which are very minimally invasive with least hospital stay and least complications. If you are suffering from urinary symptoms due to prostate enlargement, immediately visit your urologist and you can openly discuss about treatment options available nowadays, and you can choose which treatment is suitable for you. Thank you.